Okay, hello everyone. My name's Kaylynne. I'm in the MPH stream, and I did my practicum placement program planning and implementing parenting programming in my town of Hay River, Northwest Territories. So why is parenting important? Parenting is such a hard job, even for the most educated and prepared parent, but yet it's so important for society. The experiences in early childhood and the quality of parent-child interactions can shape and inform behavior well into adulthood. And while the impact of early childhood experiences can be seen across a wide variety of different cultures and geographies, Aboriginal children in Canada are at an increased risk of a broad array of different health outcomes. Parenting programs have been successfully implemented both in the community context and in randomized control trials, and providing access to evidence-based parenting programming at the community level, particularly to high-risk individuals, is an effective way to help prevent issues dominoing into adulthood. So I did my practicum placement at the Hay River Health and Social Services Authority, particularly in the Department of Public Health. We are a community of about 3,600 people. The Health Authority services the town of Hay River, as well as the Catlow DJ First Nation Reserve and several outlying communities, which adds up to about 6,000 people. Through the completion of well child clinics and preschool screening programs in 2015, public health nurses and the participating teachers began to notice that more and more children were not ready to enter kindergarten. They were falling short of the appropriate developmental milestones, and this resulted in an increased number of kids who were being referred to speech therapy and occupational therapy. Many of the children delayed speech delays, as well as difficult to manage behaviors and attention problems. So it was at this time that we identified a need to create some type of programming that would help change these outcomes. So the goal of our project was to develop and implement a parenting program. We wanted to educate and support parents and develop a program that was based on parent-centered learning. We wanted to build upon their skills and the information that they already had to make them better parents and to better prepare their children for school and for life. And in the long term, we wanted to make sure that more 5-year-olds in Hay River were ready to enter kindergarten. So in order to do this, we applied for external funding and were granted $15,000 from the Government of the Northwest Territories Wellness Initiative funding, and this was shared between postnatal programming, like our parenting programming, as well as prenatal programming. So the first step in our kind of program planning process was to identify our stakeholders. Our priority was community consultation and collaboration with the agencies that are already working with our target population. So this is a list of some of our stakeholders. They range from the school boards and teachers to the Literacy Council to the community health representative on the reserve, and most importantly, parents and other Public Health Agency of Canada programs that target parents with children under 5. So the first step was to determine what the community needed and what the parents wanted. We didn't want to provide programming to parents that they didn't find useful or that they weren't going to attend. So we consulted with our stakeholders. We also consulted with parents through the use of questionnaires offered at local health fairs, as well as informal discussion. And we conducted a short literature review in order to find a pre-existing program that was offered that would meet the criteria and meet the needs of our community. So the criteria we developed based on our needs assessment for a parenting program was something that was current and had up-to-date information, something that had accessible and affordable training opportunities for our staff, which living in a small town up north can be difficult. It had to have appropriate resources for participants in both English and French. It had to be adaptable to a northern climate as well as to different subpopulations within our community, and it had to be evidence-based with proven outcomes. We ultimately chose a program called Nobody's Perfect. It is created and owned by the Public Health Agency of Canada and has been offered across Canada since 1987 in both French and English. And it's based on a parent-centered approach that aims to provide practical, positive, and inexpensive ideas and approaches that can be used by all parents. So the next step, once we discovered that we were going to use Nobody's Perfect, was how do we have our staff trained? So we were in consultation with the provincial Nobody's Perfect coordinators in Northwest Territories as well as provinces nearby. And we found a couple of training opportunities, but the cost of having staff trained out of territory is really expensive because you're looking at hotels and per diems and flights. So ideally we wanted to have staff trained in the north. We were also in contact with the Public Health Agency of Canada, and because Nobody's Perfect was revamping their program and they were rolling out new parent education materials in February of 2016, they were offering training in Yellowknife, but only to the Public Health Agency of Canada funded programs. So at this time, despite the fact that we had proven that there was a need in the community and we had our own funding to send staff, we were not invited to this training. But through our partnership with other FAC-funded programs in town, as our stakeholders, we managed to arrange to have one of our staff sent on behalf of the FAC-funded program in exchange for offering Nobody's Perfect to their demographic and the parents that attend their programming. So in order to get the word out and advertise and get participants, we did different types of advertising. So all of the parents that attended Well Child clinics in the few weeks leading up to the programming were provided information and invitations. We also provided posters to all of our stakeholder groups for advertising, and they were also provided in town to many of the businesses to put on bulletin boards in both French and English, as well as social media. Another way we wanted to make sure that we were getting parents to our sessions was by making sure we were removing all the possible barriers. So in our needs assessment, we discovered that many of the barriers included the cost of a program, lack of transportation, lack of childcare, a negative perception of the other participants who might be coming to the program, and a previous bad experience with either programming or healthcare in general. So in order to combat these barriers, we provided the programming at no cost. We provided free transportation and cab fare to and from programs, as well as on-site childcare. We also provided incentives like food and giveaways, and we also provided reminder calls to parents before sessions to help combat forgetfulness and no-showing. There were many challenges throughout this project. So training opportunities were one challenge I mentioned. So the cost of having staff trained down south can be very high. And not being invited to the training opportunities in Yellowknife was definitely a major challenge. And the training opportunity in Yellowknife was postponed shortly before it was to begin and was rescheduled, but at the time it was rescheduled, we were no longer able to send our staff member. So we had 2 staff trained in Edmonton, and we still have 1 staff untrained. Timing was really difficult because we were working based on the fiscal year and had to have all of our funding spent by March 31st, which included having all of our materials purchased and staff trained. We also lost our territorial coordinator. She was elected as an MLA in Yellowknife shortly after we began the project, so we weren't able to use her guidance and expertise throughout the project. Some of the strengths included new parent resources, so Nobody's Perfect had brand new parent resources that we were able to give parents. We enhanced our community partnerships through public health and with the community agencies, and there was an increased awareness of community resources in town. So some of the implications for public health practice include destigmatizing parenting difficulties in the community, normalizing parenting behaviors, and also by having parents be part of a group with other parents maybe struggling with the same things, that helps reduce the amount of isolation some new parents feel. We also wanted to promote the value of parenting programs, so by continuing to offer programs that have proven positive outcomes and by reestablishing these positive outcomes, that helps us establish the need for continuing funding and sustainable funding for this type of program. So in conclusion, we had 12 participants registered in our first 6-week session, and that session just ended last week. We're currently planning sessions for the South Mackenzie Correctional Center and the men that are incarcerated there, as well as sessions for parents on the Catlo-Diche First Nation Reserve. And as a final note, I would just like to thank everyone in Hay River who's watching, and particularly my supervisors, Francis and Judy, and everyone at the MPH, all the faculty and staff at UVic throughout this MPH program, and my family and friends who have provided support, patience, and lots of childcare.
Thank you. Questions?
My name's Jean. I just wondered whether you used elders at all in the community, or you had any kind of cultural component because it was a First Nations community that you worked with.
Yeah, so we did. Several of the community stakeholders were Aboriginal-based agencies. So a lot of our consultation from the stakeholders came from people who worked with that population a lot and had a really close relationship with elders in the community and with parents in the community. So in addition to our parent consultation, we felt like we were able to get a fairly good understanding of the needs based on consultation with the stakeholders as well.
I have a question about the tools of assessing outcomes, because obviously a program is put in place, but a very important part is obviously to assess how both short and long-term outcomes. So what sort of tools are there in place, and how expensive are they to actually implement?
So Nobody's Perfect itself, the Public Health Agency of Canada program, they have an extensive evaluation component to that program. So the facilitators, when they go to the 4-day training, they are also trained to evaluate their program through discussions with the parents throughout the programming, as well as self-evaluations, and they have evaluative templates that they use to evaluate the sessions themselves. In terms of long-term outcomes, we're hoping to see fewer referrals to speech therapy, fewer referrals to occupational therapy, and more kids going into kindergarten ready for school.
Okay, thank you.